This is 𝘂𝘂𝗱𝗏𝗂 in Chicago, and you are watching my channel, Knowledge for Quality of Life. Friends, I welcome to those who have recently joined the channel and this group of community of learners. Basically, what we do here, what I do actually, I share my knowledge, I share my footprints for the last 8 to 9 years, what I have learned over time as far as my healthcare and my family's healthcare is concerned. And I've done over the last over 2 years many series of vlogs in shorts, and short vlogs regarding individual topics. And today, what I'm going to do, I'm going to give you a summary because I see a lot of confusion out there, and by no means I'm saying that I have all the answers for you. This is my footprint, as I said. What I have done in the past 9 years myself. Because at one point I was in the same, boat that I was confused that, all people are saying, sometimes people are saying eat keto diet. Some people are saying whole plant-based, and, variety of nutritionists are giving some wrong information, which is outdated. I wouldn't say wrong, but outdated information because, they have limited picture. And I've been covering many ideas over time. For instance, I'll give you an example that, people say that eat whole grain food, right? So people who are, carb-laden diet, or even though you eat grain, if it's even whole grain, and you have an issue of particle distribution, in your NMR, it's going to increase. It's not going to reduce because, they are missing the boat that, insulin is the biggest elephant in the room. All right. So I have covered many areas, but today I'm going to do, something that, it summarizes the big points, so that as I have done to myself, right? I have applied all those points, all those pointers over the course of last 8 to 9 years, and I have seen dramatic improvement, and I'm sharing those in the form of bullets. So first of all, first and foremost, if you see my last 2.5 years series of vlogs, the most emphasis I have given to any topic is vitamin D. So if you want your health for the longevity of your health span and the best to fight the disease, you want to take your immune system to the next level. First and foremost, not the only one, by the way, it's not a silver bullet, but first step, as I said in the past many times, that you have to fix your vitamin D. When I say fix, means optimize your vitamin D around 60 and above. Okay, they say 40 to 60, but I've shared many vlogs on various non-communicable diseases that how your probability of getting those diseases almost vanishes once you are 60 or above, right? And there is a protocol to increase your vitamin D. Some people are asking me questions that, I'm having a hard time in raising my vitamin D level because there is a protocol you have to follow, which I have explained in many vlogs. Particularly, you have to take with the largest meal of the day, number one. Number two, you have to have some fat with it, little bit fat, not a whole lot, because I've shared in the past that, if you eat too much fatty meal, your D is going to get dissolved too quick, and it's not going to be available for better absorption in the course of time. So you need a little bit fat. Now, when I had this question, when my D was going, not increasing that much, and what I was doing, I was eating with full avocado. Now, full avocado has about 26 grams of fat. So I was digging the information that what is it, because they say that eat with fat, and it's giving me some kind of a not boost up in my vitamin D level. It was increasing, but it was not increasing. At one point, it increased and it dropped because I incorporated that full avocado. So I learned over time, and I was vividly doing the research and found out that there was a study done that what is the ideal fat level you have to include. So they did 3 groups, one with no fat at all, one with adequate fat and one with the biggest fat, fatty meal, right? So the adequate fat, the moderate fat content was about 11 grams of fat to be exact, right? Now, 1 tablespoon of extra virgin olive oil has about 14 grams of fat. So, I eat 2 to 3 tablespoons of homemade grass-fed yogurt. That's good enough for me, right? That's what I've been doing. Of course, you have other, menu in your main course meal, like sometimes fish or something, but that's okay, But when they did the study with the 26 gram or more fatty meal, then the absorption of D was not available that much, right? So I learned something about 8 years back that, you cannot have too much fat when you consume vitamin D. Remember that. Some folks are going to have a hard time in absorption of vitamin D if you have a gallbladder issue. Some people remove their gallbladder. Now, not because of the gallbladder, because you need bile. You need bile to get your D or fat soluble vitamin absorbed in your lower gut. Now, once you don't have the gallbladder, of course, you are not going to have your bile available for vitamin D to absorb in your lower gut. So sometimes, you have to consult with your doctor, and he or she would suggest you that you have to take a bile capsule or some kind of a form of bile tablet, with your vitamin D level to increase the absorption capacity. Some people are, very few though, some people are genetically carry a variant which inhibits vitamin D absorption. So you have to consult with your endocrinologist that, are you exposed to that kind of a variant or not? Okay. So make sure that, when you say, when you take D, you have to take with K2, you have to take magnesium, you have to take with C, vitamin C, because all these three are cofactors. They dance together with D. Okay. So remember that, and I have done many vlogs in detail. So watch those vlogs. So first you need to fix your D. Second, eat clean. Eat clean means close to the nature. Avoid all the processed foods, avoid all the ultra processed food, and avoid all the refined carbs and sugar. Okay. So when you do that, what's happening? Go to the next level, right? So eat as close as possible to the nature, the way nature has produced food produced in our daily life. Now, when I say eat close to the nature, each and every individual is different. Okay. Now, those fruits which has high glycemic load, okay, you have to be mindful for that, because it's going to increase your triglyceride, or your small dense particle. If your objective is to be heart attack proof, or your small dense particle to be as low as possible, then you have to make sure that you avoid all the glycemic load foods or fruits. Okay. What is glycemic load? Because you may have heard glycemic index, but Harvard tossed a new term a few years back, that they said that if you look at the glycemic index is the sugar content, glucose content, but glycemic load has two components. One is glycemic sugar glucose content, and then the other factor is carb, because ultimately the carb converts to the glucose. So you have to be mindful that the foods you pick, make sure that they are low on glycemic load. Okay. So glycemic load is the better marker to check for the food and fruits, and go for those low glycemic loads if you want to be insulin sensitive. Okay. If people particularly who are insulin resistant, they have to be very, very extremely mindful of that. Okay. Because I don't think any nutritionist, which I've been reading the newsletters, or it comes to the paper or articles, they are emphasizing as much as people are hammering on meat and saturated fats and all that, but they're not talking about insulin resistance and insulin sensitivity. Okay. So main thing is that if we want to protect ourselves from heart disease, Okay, these are the steps you have to, because I shared my case study that, you know, I had issues. I was borderline, you know, insulin sensitivity index like 33 in one of the vlog, and you know, you have to be, you know, below 33, ideally as low as possible. And from 33, I dropped myself to 6 only. Okay, on 0 to 100 scale. So it's all about what we put in our mouth. Remember that, you know, what we eat, that dictates our destiny as far as the health is concerned. Of course, exercise is important. I've mentioned so many times that you have to be active. Now, the type of exercise, I have done one vlog on that, you know, that what is the sweet spot. So please make sure that, you know, you look at the whole, you know, connectivity of everything if you want to see the bigger picture of your health. Now, when you do that, you know, eat clean, eat, you know, avoid all the carbs and everything. Of course, you are going to lower your triglyceride. Okay, your triglyceride, as I said in the past, that you have to focus on two things when it comes to your lipid panel. People don't pay attention, including doctors. They are very much bogged down by this LDL thing. I don't even bother, or I don't even look at the LDL. I make sure that, you know, my eyes are like a hawk on, you know, I monitor very closely my triglyceride and my HDL. Okay, now HDL has a direct correlation with your vitamin D level. When you raise your D level to 60 and above, and you avoid all the carbs like refined carbs and sugar, whether it's a natural sugar or refined sugar, I don't care. Okay, you avoid those and give about 1.5 to 2 years. Now, I didn't invent this concept. Okay, I read vividly Dr. William Davis, and I applied to my case, and you know, I saw the dramatic result. You know, my original HDL was at 27. Now recently it is at 64. So that's over 180% jump. Okay, now with males and a lot of females, including in Asian community, this is the biggest problem, that, you know, we have a low HDL because the type of diet we eat. It's not like some people said that we are genetically disposed to have low HDL. That's not true. I don't think so, because if I can reverse it, you know, any Asian can do it. Okay, so it's the type of diet. I realize that it's the type of food that we eat that, you know, and also the majority of Asians, because we have a darker color pigmentation of our skin, and we are on the low side of the vitamin D status. Okay, so once you fix your vitamin D above 60 and avoid all these, you know, refined carbs and sugar, and give about 1 to 2 years, and slowly your, you know, HDL is going to creep up higher and higher. Okay, because this HDL is the key factor, along with your triglyceride, in depicting your heart disease risk. Because as I said in one of the vlog, it's your triglyceride divided by HDL ratio. You know, they say that, you know, it should be less than 2, but I target it should be ideally less than 1, which is the optimum ratio. Okay, because at one point I was at 3.33. Okay, now I'm standing at 0.7. Okay, because I lowered my triglyceride from 90 to, you know, almost 45, and I increased my HDL from 27 to 64. So now, you know, because it works inversely, because when you increase your HDL, your triglyceride goes down, and when you lose your weight, your HDL goes down, because each pound you lose, there's a kick you get in your HDL, because, you know, your HDL is your weight dependent. Now, when you deprive yourself from all these junk like sugar and, you know, refined carbs, guess what? You're going to lose weight automatically. Okay, and then slowly it's going to reflect in your HDL along with your vitamin D status. Remember that. Then you monitor your HSCRP. Some people do it CRP. I personally like high sensitive C-reactive protein. Now, this protein, liver spits out in our blood to give the, you know, status of our inflammation. If I get a cut on my skin, then I can see that, what's going on. But we can't see our inside lesions which gets created inside the artery because of what we eat. Okay, remember that these diseases which we are talking about, by no means I'm trying to paint a really horrible picture. This concept of insidious nature of the disease I'm trying to explain, that the diet takes us inch by inch to that level where we don't want to see ourselves. Okay, and it takes years probably to get there, and by the time we get there, we get the symptoms in the form of a disease, because the disease already manifested itself inside, because it took years to develop, because you were not monitoring, because your hsCRP is going to indicate that what kind of inflammation you are going through. So that is going to be a first marker to check whether you are eating a clean diet or not. A lot of Indian folks, a lot of Pakistani folks, a lot of Asians, we eat canola oil, variety of seed oils, okay, in our cooking. That is a no-no. These are highly inflammatory oils, okay? These are highly inflammatory oils, including, trans fat and all that, so avoid those from your diet, okay? A lot of people say that, avoid, desi ghee, which is a clarified butter, okay? Now, desi ghee is I say yes and no, okay? Because when I look at it, at the research level, it's not one, bullet answer. So I'm not gonna say yes, it is good. I'm not gonna say no, it is not good, because it depends on your genotype. So people who are carrying the genotype 4, whether one copy or double copy, they are supposed to avoid saturated fat from your diet. Now, clarified butter or desi ghee is whole lot saturated fat. There's no mono and poly in it, very little maybe. Okay, majority bulk is saturated fat, because those people who carry ApoE genotype 4, whether one copy or double copy, they have a risk of dementia in the later part of their life. So one of the protocols, they say that, to mitigate the dementia and memory issues, avoid saturated fat as much as you can, right? Which includes desi ghee, which includes beef, which includes all the saturated fat, coconut, or coconut oil, all those saturated, all the contents of the food or produce which has saturated fat, avoid it, okay? If you carry a copy of 4. Now, this is once in a lifetime test to check ApoE genotype, and I've shared that type of the test in one of my vlog. Please see that, okay? So then people said that, extra virgin olive oil. Now, more than 85 to 90% extra virgin olive oil, the way they market it, they are blended oil. It's not monovarietal. This is multivarietal. They take from places to places, and they mix with seed oils, and they bottle it, and you can see in the United States in the aisle. Or I'm not saying, I'm not blaming that everyone is bad, but you have to do your homework, okay? You have to do your due diligence. So let's say if you take a bottle of extra virgin olive oil, find out from the manufacturer that what kind of a polyphenol content this oil has. If you can't find the information to verify this MSDS sheet from the manufacturer, don't use it. That's how I practice, okay? I don't use any olive oil unless I know the chemistry of that oil, particularly if the oil is coming from EU, either from Greece or Spain or Italy, depending on, get the MSDS sheet from the manufacturer if possible, or whoever is selling you. Find out, do some homework, dig it up. If it's a traceable oil, then you should be able to trace it, because there's a 5 or 6 digit code on the extra virgin olive oil bottle or tin. You can trace back and see where they are getting it from, where they are sourcing it from the time of the pick the olive from the grove till the bottling of in the plant. Okay, bottom line, I'm saying that you know the chemistry of the extra virgin olive oil, because it's a pure liquid gold if it's a good oil. Okay, and I've shared one of the vlog, because I particularly visited earlier last year, in later part of the last year in October to Greece. I visited almost 20 days. I saw the plant, how the oil is extracted and all that. So the type of oil is very critical which you are using. You cannot trust blindly any extra virgin olive oil, but it has an amazing effect on your health. Okay, I have observed it, and I take 2 tablespoons daily with empty stomach first thing in the morning. Okay, I drink it. Okay, that's my shot, everyday shot. Then you next, after monitoring your hsCRP and your HOMA-IR, how you monitor your HOMA-IR, I explained in the detailed vlog. You check your fasting insulin. That's the biggest elephant in the room nobody's talking about in your blood work. Nobody tests this thing, fasting insulin. Everybody is going after fasting glucose or HbA1c, but you take the fasting insulin and then you multiply by your fasting blood glucose and you divide by 405 if you are in the United States or you are working with the English unit, and you get a number. If you are less than 1.5, ideally you should be less than 1, then you are insulin sensitive. But if you are between 1.5 and 1.9, then you are getting pre-diabetic or you are getting in the borderline range, and that's an alarm sign. If you are above that, then probably you are full blown. Okay, you better, because what happens that your HOMA-IR is going to indicate you first indicator before the HbA1c or fasting glucose reflects that. Okay, by the time you are going to monitor the reflection in HbA1c or your fasting blood glucose, it might be too late, but it's still reversible. Okay, so what I'm saying that what are we trying to do? We are trying to be proactive in our health, proactive in our healthcare, so that we don't want to visit the doctor when we become sick. Okay, that's the point I'm trying to allude to. Okay, that's the whole strive, and that's the whole effort we are trying to work on. So you have to monitor hsCRP. That's the inflammation marker inside, and ideally they say that it should be between 0 to up to 3, but I target less than 0.5. Ideally it should be less than 0.5, but it should be less than 1. Okay, so that's the number. If it's picking up, going up a little bit, something is going on in your health. Okay, that's the first marker, because before you even see the symptoms, this is the first marker. If it starts creeping up, it means that your inside inflammation is going higher. Now what happens when you have the inflammation? That's the first problem happens in the manifestation of the heart disease. When inflammation goes up, your endothelial lining, inside layer of your artery, gets damaged. They get lesions. Okay, those gets cracks, fine tiny lesions. Now those lesions, they get repaired by the cholesterol, because cholesterol flows through it, and particularly those small LDL particles, which I've talked about in the past in my NMR and cardio IQ panel. Those gets oxidized and penetrate through those lesions and build a plaque behind the endothelial layer. Okay, that's the starting point of atherosclerosis, and the plaque builds up, and it keeps going up to the point where this lining gives up and the plaque ruptures. Okay, and if it forms a clot somewhere, that's, if it goes from here and above, that would create a stroke. And if it's below the carotid artery, below your neck, that's the state of the heart attack. So these are the two things we have to be mindful of, because we have to monitor this disease. Okay, these are multi-headed dragon, so we have to take one piece at a time. So that's why I'm listing all these things. So hsCRP you have to monitor, and you have to monitor your HOMA-IR, because you want to make sure that you are insulin sensitive. Okay, then you have to monitor on a yearly basis, because majority of the doctors are doing the standard lipid panel, which is obsolete. And I have said many times, they measure total cholesterol, HDL, triglyceride, and LDL. It doesn't give you a lipid panel distribution, because cholesterol Remember that. See how the nature works. I get fascinated when I read science, and I think that how nature has made us, how nature has wired us. Okay, the cholesterol is a raw material provided by our liver. That's how the nature has wired us. If I don't eat anything, if I live on water, my liver is going to produce 75 to 80% of the cholesterol. Now, this cholesterol is 7-hydroxy, the chemical name. This is the basic raw material for all the hormones which we need, of all the cells which we have in our body to function. If we don't have cholesterol, we would be dead. Okay, so this is the basic premise. Cholesterol is the basic premise for our life. Now, when this 7-hydroxy under the skin in the artery gets connected with UVB rays, sunlight, okay, and that UVB rays turns that 7-hydroxy to 25-hydroxy. Now, that 25-hydroxy is nothing but inactive form of vitamin D. So basically, vitamin D is produced by cholesterol. Now, think about it this for a minute, okay? Let it sink in. Cholesterol is needed for vitamin D to produce, right? Now, doctors are giving us statin to lower the cholesterol. Now, we are depriving ourselves from the basic raw material, and then another set of doctors are saying, don't go in the sunlight because you are going to get melanoma, skin cancer, right? So we are depriving ourselves from sunlight, and we are lowering the cholesterol because we think that, cholesterol is the bad guy, right? Because it creates the heart disease, right? Think of what? First, you have the inflammation picking up, and then the lesions are going to create inside the arteries. Then, just like exterior cut, if I have an exterior cut, if I leave it there, blood is gonna stop bleeding. It's gonna clot after some time, and it's gonna form a repair mechanism. After a few days, the repair mechanism is gonna start within few days, within few hours actually, and after a few days, the new skin is gonna generate. The same thing happens inside. We can't see that, unfortunately. The cholesterol is going to try to repair that lesion and then build one layer over the other. And it takes years to manifest this atherosclerosis. And the artery, which was like this, in a pristine condition, it's going to get narrower and narrower and narrower, right? And one day, when this, unstable plaque ruptures, then it's going to form a clot anywhere while flowing through it, okay? So make sure that you are clean in your diet so that your inflammation is low and you are insulin sensitive. If these two things are down, way down, then there is no chance, because they have found out in Framingham study. Framingham study is the largest study on the planet, for heart disease. Framingham is a town. You can Google it. You can research it in National Institute of Health papers and everything. It's very well documented. It's scientifically documented very well by many cardiologists. This is the largest study of heart disease in the last 70 years. And 40% of the death, heart attack related death, occurred when people had normal cholesterol under 200. But they found out that they were insulin resistant. They had high inflammation markers. They had less insulin sensitivity, okay? They were towards insulin resistance, means they were either pre-diabetic or they had too much insulin carrying in the body, and over time, this atherosclerotic plaque forms, okay? So it's not about lowering the, your cholesterol by statin drug that, you are becoming a heart attack proof, right? So you have to do basic due diligence that what is needed, okay? Because you have to stop the fire, cause of the fire. The cause is your inflammation, and first comes the inflammation through your, diet and your insulin resistance. These are the two things go hand in hand. Once you fix that, then, you have to monitor that, you are okay on the NMR. So NMR, I have mentioned in the past that NMR is the lipid particle distribution test, or cardio panel IQ, advanced IQ test. It gives you a different types of variety of particle distribution. If your diet, mark my words, if your diet are sugar driven, too much refined carbs, too much natural sugar even, okay, you're going to generate more small particles, okay, you're just like a golf ball, okay, you are going to generate more particles, like small tiny particles, which are atherogenic in nature because they oxidize faster, and you are more atherosclerotic prone. You are becoming more and more, okay. But if you deprive yourself from refined sugar and all the natural sugars and all the refined carbs and all that, you start eating clean, okay, then your small particles are going to go down and down. They say, experts say that you should not have more than 20% of small dense particle out of total number of particles, okay. So 80% you should have a larger, fluffier type particles. Less than 20% you should have a small particle. The lower the better, okay. And I explained in my one case study that at one point I had my small dense particle 666. Now I'm around 180. So that's about 73-74% lowered, and I didn't use any statin drug, okay. It's just a lifestyle and the food I eat, okay. So if I can do it, anybody can do it, okay. So these are the things. Now people who are living in the third world country, or the place or the country where they don't have an NMR, or cardio panel IQ, lipid panel distribution test, then they can work with these 4 numbers: triglyceride, total cholesterol, HDL, and LDL. All you have to do, you start bringing your 2 markers in check, triglyceride or HDL. Try to bring triglyceride and HDL ratio under 2. If that is under 2, then you are correlating that your small dense particle is less than 20%. If it's under 1, probably it's going to go much lower than that, okay. So your target should be your triglyceride over HDL ratio. Try to bring as low as possible, okay. I hope that this summary of related to cardiovascular disease, which I have explained, that how I tackle each and every parameter over the course of 8 to 9 years. And this is not something that it's going to help you in only cardiovascular disease. It's, if you fix your D and you start eating clean, you are going to be dealing with lowering the probability of your cancer, your diabetes, your neurodegeneration, because this is the basic premise what I have laid out today in those parameters, okay. And hopefully we'll talk more in the weeks to come, but my message today was to summarize something. People are confused, people are hungry for knowledge, but you have to take one step at a time. So I have laid out, fix your D first. Make sure that fix your D, because D is the most important thing I can vouch for, okay, in your healthcare. If you fix your D, a lot of issues in the years ahead, you're going to mitigate that. With this, I'm going to take, I'm going to say goodbye. I'm going to end this vlog, and I hope you stay warm if you're in the United States or Canada or wherever there's a cold weather, because we are going to the frigid weather here in Chicago. We are experiencing 25 to 30 below wind chill. And I went this morning for groceries, and I bundled up, but we are used to it in Chicago, so it's not unusual. I hope you stay warm and take care.